Over to you, Ma'am Arlene.
Yes, sir. A very good evening and a warm welcome to today's program entitled Upfront During COVID Times, Reach Out and Responsibility. For today, we have a very esteemed, young and dynamic speaker for today, and none other than our very own Deputy Commissioner of the East Khasi Hills, Ms. Isawanda Lalu, IAS. Welcome, ma'am, to this program. We also have with us our principal, Dr. Brother Albert Longley Dakhar, and our rector, Dr. Father Joby Joseph. Welcome to all the panelists. And I'd also like to welcome all our esteemed participants who are participating from far and near through varied ways, listening to this program, hoping that it will benefit us in some way or the other. Before we begin this program for today, I would like to request Father Joby to actually lead us in prayer.
Thank you, Ma'am Arlene Karnongrum. Dear Honorable DC of East Khasi Hills, Ma'am Isawanda Lalu, Brother Albert, our principal, Ma'am Arlene, Sir Nathaniel, dear faculty, dear students, and all well-wishers of the college. As we have this opportunity, a unique opportunity to have our own Deputy Commissioner to address the Andonian family, we are indeed privileged. And we turn to the Lord who gives everything possible, who is our protector, our guide, and the one who is in control. We spend a moment of prayer. Let us place ourselves in the presence of God, Father, Son, and the Spirit. God our Father, we listen to a reading, your own word from the Holy Scripture, Psalm number 147. The Lord heals the brokenhearted, and he binds up all their wounds. He determines the number of the stars, and he gives all of them a name. Great is our Lord, abundant in power. The Lord lifts up the downtrodden, he casts the wicked to the ground. Sing to the Lord with thanksgiving and make music to your name. And Lord, our prayer today is, search me, O God, and know our hearts. Test us and know my thoughts. See if there is any wicked in our hearts, and lead us in the path of life eternal. God our Father, we pray in a very special way for our state, the administration, and in particular for Ma'am Isawanda Lalu, under whose able guidance, Lord, the district and many people, volunteers, doctors, nurses, are in the field caring for the sick, caring for the needy, and seeing to every aspect duties, responsibilities, and reaching out. Lord, we ask you to be our protector, our guide, to give wisdom, your gift to all of us. Lord, we pray for Brother Albert, our principal. We pray for Mama Arlene, Sir Nathaniel, and all our faculty, our students, support staff, and especially the students and their families. Keep us all under your care. Protect us and lead us always in truth. Give us peace when we are disturbed. Give us light when darkness sheds in. And give us meaning in moments when we lose. May you guide us. May you lead us. In your precious name, Lord, we pray. Amen.
Thank you, Father. And now I would like to request our principal, Dr. Brother Albert Longley Dakhar, to kindly say a few words and welcome our guests.
Am I audible?
Yes, brother.
Yes, Father.
Hello. Srimati Isawanda Lalu, IAS, respected Deputy Commissioner, East Khasi Hill District, our resource person of this evening. Reverend Father Dr. Joby Joseph, Rector, St. Anthony's College. Professor Arlene Karnongrum, Faculty, Department of Value Education, and the MC of this webinar. Faculties, students, and attendees, I have the august privilege of extending our warmest welcome to Srimati Isawanda Lalu and to each one of you here to this webinar on Upfront during COVID times, reach outs and responsibilities. To say that the pandemic has been life-changing is an understatement. The COVID-19 virus, a fragment of the dimension of a human hair, has almost completely overhauled the world and its various structures, institutions, systems, and facilities. People's lives have been practically re-engineered, so to speak. Although pandemics have occurred in the world, such as the prehistoric epidemic about 5,000 years ago that wiped out an entire village in China, the plagues of Athens, Antoine, Cyprian and others, the Black Death, and so on, it has never been hit by anything like COVID-19. The outbreaks of SARS and Ebola in the recent past were disturbing, but they fortunately ended rather quickly and fortunately. But in this instance, the virus has been very resilient and virulent. Needless to say, we have had to adapt to the situation, just as the virus is seen to be adapting to the circumstances it is finding itself in. We see how the frontliners in the medical field are constantly on their feet, waging frantic and intense battle every moment to save precious lives under their care. We hear and read of scientists work hard at their labs to find way to stop this virus in its track. We see various social institutions and organizations working dedicatedly to help those who have their livelihood taken away from them. And we also see the administrative officers and institutions of the government hard pressed into service to ensure the safety and welfare of all people in the cities and in the regions. But still, we cannot but help ask ourselves the question, is it enough? Are we doing enough to combat the virus? Will what we are doing so far see us through to better days in the future? And Pat comes another question alongside. What else can be done in this regard? There are always many voices in such situations shouting hoarse, or in the present scenario, texting agitatedly, highlighting the gaps, the flaws, the oversight, and the ineffectiveness of what is being done so far. And in amongst those threats of heated vitriol, there are these feeble lines from others who feel that there is only so much that the government can do. This webinar today is an attempt to steer away from such debates, armchair attempts at running the show from the comforts of one's home and the like. It is my belief and conviction that the only effective way for us to beat this pandemic is by coming together and pitching in all our resources in the most appropriate way possible, channelizing them in very intentional and specific ways that meet the need of the hour adequately. We cannot sit back and hope that the virus is just going to die on its own. It has to be eradicated or at best rendered sterile so that it no longer is a threat to us in the long run. And to achieve this, concrete efforts, meaningful initiatives, and unstinting support from all sections of society will be required. As a college, we are doing what we think is appropriate for an educational institution to do in such a situation. We are ensuring the mental health and welfare of our students, staff, and faculties. We have made our facilities and assets available to the government for use in address COVID-19 related needs. Last year, our faculties and students assisted in taking care of those who were stranded here due to the lockdown. Many of our students from the NCC and NSS were posted in various care centers in the city. In collaboration with sister concerns, we have contributed essential items to poor families in far-flung villages of the state, donated masks and PPE to hospitals here in Shillong, and financial assistance to the CM's fund against COVID-19. Academically, we have held workshops, seminars, talks on how to address online education, training teachers for the shift to online education and other relevant themes. But in hindsight, we always knew that what we have done so far is but a drop in the bucket, and more will be required of each one of us as we state at what could be a long battle against this pandemic. And in such a situation, the best thing that we can do is to explore avenues, educate ourselves further, and gain fresh and new insights that will equip us to assist our fellow human being during these dire times. I am deeply grateful to our respected Deputy Commissioner, Srimati Isawanda Lalu, for accepting to be our resource person in this webinar to enlighten us further on what can be done either to assist the government or to alleviate the suffering of others caught in the crossfire of this pandemic. As our Deputy Commissioner, she has been very proactive and interactive as well. We cannot help but feel being assured that the government is doing its best to ensure the safety and well-being of all citizens of the state. On behalf of all of us at St. Anthony's College, I would like to offer you our sincere gratitude for giving you your all in this fight against the virus. Ma'am, carry the wishes of our college from the staff and the student to all your team in the office for such a great service that you all do. And we are there with you. As I said, what more can we do? Please do tell us. And as I close, I would like to reiterate my welcome to each one of you to this webinar. Thank you for all joining us today. Evermore, better ever. God bless you.
Thank you, brother, for your warm welcome. Now I would like to invite our speaker to kindly take the platform. Ma'am Isawanda Lalu, the Deputy Commissioner, East Khasi Hills District.
Thank you so much. Am I audible to everyone?
Yes, ma'am.
Yes, ma'am.
A very good evening to all of you. Professor Arlene for chairing this webinar today. The Principal of St. Anthony's College, Reverend Dr. Brother Albert Dakhar, who has given that very kind introduction and which has really laid out so many of the things which we are, pondering over these days, and has also set the tone, I think, for today's webinar. Rector, Father Joby Joseph, who has gotten in touch with me well over a week ago, inviting me for this webinar, and for which I am very, very happy and grateful to join. I'm also pleased to note that he is very active on social media. He has even tweeted about this and tweeted to me as well, reminding me about this talk today. So I have assured him that, Father, don't worry, I will be there. It is my privilege to be able to say a few words, yes, despite a very, very intensive and busy schedule with the students of this esteemed institution. Professor Nathaniel and all the faculty and staff of the department and of the college as a whole, and most particularly my young friends who are watching. I cannot see you, I don't know your names, but I can only see the attendance on the side. And yes, some of the names are visible, some of the gadget names are visible. So thank you so much for taking the time to join in. And yes, these are trying times for all of us. I think Brother Albert put it very well when he said that this is something which, this pandemic which we're going through is possibly not just once in a lifetime or once in a generation, but something that is possibly once in a century, that will be written down in the history books. We talk about the Spanish influenza, we talk about those great plagues which Brother Albert had talked about. in the years to come, in the decades to come, perhaps even in the centuries to come, people will talk about this pandemic, and history will also look back at how we who are living in these present times, how we handled it. What did government do? What did health institutions and medical professionals across the world do? How did the scientific community of the world come forward to tackle these times? What did communities do? How did this pandemic affect people across such a wide spectrum of society? How did it affect big developed countries as well as small remote villages in the hinterlands? We are living out this crisis at the present, so it is very, very difficult to see with an eagle's eye, or to have an all encompassing view of what this means yet. To think about what our role is, what our community's role is, and what we can contribute individually and collectively to make these times a little easier. Please inform me if my network is unstable or if you cannot hear from time to time. I hope I am still audible.
Yes, that's fine, ma'am.
Thank you. So having said that, I think all of you, first of all, must be, I think, impatient. We have gone through this once before. We have gone through this last year. And my solidarity in these times is especially with the student community. It is not easy, and it cannot be easy to stay home for so long, away from your friends, from your teachers, away from the lessons and values and classes, the educative process, being away from the college environs and atmosphere, which is so crucial for you at this juncture in your life. I'm sure you miss all of it, greatly. Some of you may be, on the cusp of completing your graduation. Some of you have newly joined and haven't even had a chance to get to know your classmates and your faculty members. And this is the same for students across the country, across the world, in fact, right from school kids of a very young age to college kids to university students. Like Brother Albert had said, this pandemic has altered the way we think about our lives and the world. It has changed so much, and it has also hit us like a storm. It was completely unexpected. I mean, who would have thought over a year ago, 2 years ago, we would have enjoyed having these conversations face to face in a big auditorium. But now even gatherings with 5-6 people are prohibited. We never knew that we had to hide our faces by wearing masks all the time. Of course, now with the boon that social media and the internet and digital technology offers, you can come online without having to wear a mask. But the point being is that this pandemic has uprooted our lives. It has done so much and affected so much. And most importantly, it has taken away so much. When we look at even our state's figures, it is really grim. Last year, when the first wave came, it took us all by surprise. But at the same time, in retrospect, when we look back, we can say that it was not as lethal as this second wave. And the same applies the world over and countrywide. You have seen the terrific and the scary visuals all over the country. As of now, our district, East Khasi Hills, stands at 1790 active cases, a very dynamic number. It can, increase overnight. It can go down overnight. We have many deaths per day till date. And this is something which is really a cause of concern for all of us. And as you know, yesterday our government had announced that we are extending the lockdown. What this means for many of us is that livelihoods are still very much at stake. They are plenty of people who are, let's say, really struggling, and that is a reality. A few of us, some of us may be privileged to stay at home and not have to go out and worry about our next meal, but lockdown for people who live from hand to mouth, who have to go, and earn their daily wage, means that it is a constant struggle to think about possibly, where the meal for the next day will come from. And this is where I think that as a community, as a state, as structures of governance, as well as civil society and community, as well as religious leaderships, we come forward, we step in, and we see the gaps, and we try to assist in whatever way we can. Brother Albert has pointed out all the tremendous ways in which communities and institutions have stepped forward since the last time and to date. Every single day, I am overwhelmed by the acts of generosity, the acts of kindness that we see all around us. People going and, giving food to the homeless, delivering food to people under quarantine, even giving cash, say, to people who are very hard up or cash strapped. At the same time, we have people who have rendered their services physically to be volunteers, to ensure that protocols of distancing and mask wearing are maintained in the marketplace. This is very crucial. All of us need to go to the markets, but it's not easy, as you know, for many of our personnel on the ground, including our magistrates and our police, to be out all day in the scorching heat or the pouring rain. And so this is where we have seen our community volunteers from the Shillong, from the COVID community management, from the COVID community management committees in the various localities have come forward and have rendered their services, have given their support to ensure that all our protocols are stringently followed. At the same time, we cannot forget the tremendous service and the really, I would say, almost sacrificial services which our health workers are doing, right from our doctors, our nurses, our health workers, ashas and anganwadis. I will give you a brief on, what is the structure, or what are the ways and means in which the district administration, in tandem with the health department, is working at the grassroots to ensure that the virus is contained, to ensure that awareness is made, and to ensure that people come forward to vaccinate. But what I want to stress right now is that apart from these key frontliners, we also have so many people who are, in fact, we can say, risking their lives by going out there. During times of lockdown, those who can stay home are privileged in a sense, right? Those who do not have to go out because they remain safe. And I have stated from the beginning that in as much as we can, we should try to help those who do not have this option of staying home, so that they do not expose themselves unnecessarily, so that they don't catch the virus because of sheer hunger. They have no other choice. So yes, brother had also mentioned that there's a lot of, naturally, there's a lot of, I wouldn't say just criticism, but there's a lot of public debate in times of crisis and in times of, in times of disaster. In fact, this is a disaster. It has been declared by the National Disaster Management Authority of India. And in fact, all works that are going on through the district administration under the authority also of the DDMA. As Deputy Commissioner, I am also chairperson of the District Disaster Management Authority. So in times of disaster, in times of public crisis, of course, there will be a lot of debate. There will be a lot of, back and forth, a lot of inputs on how to do things the right way. And let me tell you, many times there is no right way. There is no solution that is absolutely perfect, right? Government has entrusted deputy commissioners to regulate shops, to regulate traffic and movement. There are some cases in which, things are perfect, fall in line wonderfully. And there are some things in which, we need to do a little more work. We see the gaps, we see the issues we are facing on the ground, and we make corrective steps. So similarly, since the nature of the virus itself is so dynamic, from one day to the next. As you know, you've seen in the news that we are dealing with a really lethal variant, the Delta variant, which we called. We sent some samples for testing, and we found that a large percentage of the cases in Meghalaya are of the Delta variant, which is highly transmissible, highly infectious, and which also can lead to severe symptoms if people do not take care. So yes, while this sort of public engagement is very healthy, it's very good, I feel also that this is the time when for many of us, we can show solidarity through action, through deeds, right? And you may not be able to physically go out and give food or cash to somebody, but we are fortunate in this era that we have the World Wide Web, we have the internet, which is at our disposal, at your fingertips. So this tool can be used in such a wonderful way. This is not something which we need to just use to while away the boring hours during the daytime or the nighttime, but really I feel this tool is educative. Use it to educate yourself about the disease, about the virus, about what your government is doing, about what your healthcare workers are doing, how you can contain it, and at the same time to share positive messages and inputs and educate others. Too often I have seen, and I don't know whether it's because of people having too much time, because you know that they all say that an idle mind is the devil's workshop, but too often I've seen forwards in WhatsApp statuses and Facebook posts, which are of a nature that are really not conducive to this time and to this environment. People are already scared, in panic. Thousands and lakhs of families are affected. It is possible for us to send positive vibes through the messages that we share. I am particularly against conspiracy theorists and alarmists, people who, enjoy possibly, sharing very clickbaity items on the internet or pictures without verifying the source. So I have one particular slide which I will share for you, which I think is very important, especially for young people of your generation, to note that before we do anything, let us think of the consequences. Let us examine the veracity of that particular post, of that particular share, before we send it forward. It spreads like wildfire. So is it worth it? Why do we want to be the first to share any piece of information without being fully convinced and absolutely sure about its genuineness and its authenticity? So first of all, just to break up my talk at the very outset, just to give a very quick brief on the scenario in East Khasi Hills and what the district administration is doing. Second of all, just a few key pointers and reminders on the disease itself. And lastly, what the community can do, what students like yourselves can do. So firstly, we are happy and we are fortunate to have a team which is led very ably from the front by our dynamic chief minister, our cabinet ministers, our health minister, as well as our principal secretary of the Health and Family Welfare Department, our mission director of the National Health Mission. All the districts work very closely with the department, with the officials of the health department, and also with our doctors, our district medical and health officer, our director of health services, as well as all the numerous health experts and health workers who are with us. Every day we meet. We have video conferences thrice a week with our principal secretary, on which we share updates and we talk about the present status, what is the point of action, what is the most urgent things that need to be done. In my office, I am supported by the District Disaster Management Authority, for which we have a network and a very able team whose role is really as well as our block development officers. And the roles, as you know, of civil servants, of IAS officers, of MCS officers, and of all government servants at this time is wide-ranging. We have requisitioned the services of officers from across departments, whether it's legal, metrology, or supply, or excise, them in and called for their service as executive magistrates, as volunteers, as supervisors, as managers. In this time of crisis, the district administration deals with everything from regulation of shops and essential supplies to testing of positive persons, contact tracing, carrying out vaccination program, awareness, enforcement, as well as constant consultations, with experts, as well as engagement with community leaders and leaders of religious organizations. So it is safe to say that many of my team members, my officers and staff have barely slept in the last month and a half. And these are trying times for all of us. But let's say that, there is no other way. There is no other way. At the same time, we are nourished and we are encouraged by the fact that communities and institutions have really come forward and have really given their wholehearted support during these times of crisis. At the community level, we have the community COVID management teams led by the Rangba Shillong, the welfare societies, a number of volunteers who assist us for enforcement in marketplaces, who assist us for mobilizing people for vaccination, and even for door-to-door visits. So door-to-door visits form a crucial part of surveillance mechanism, in which we go door to door, not just to educate people, but our ashas, our anganwadis check up on people to see if they have symptoms, to see if they're feeling well, to see if they have any complaints. And this is how we can trace and track the spread of the disease at the last mile. So this is one of the things which we do. This is very roughly the structure that we have, and we are constantly in touch with people from a wide spectrum of society, and we also take inputs from community leaders and even from from the common man. Second of all, what I would like to share with you very briefly through a short presentation is just some key. Can you see my screen?
Yes, ma'am.
So these are just this is a training presentation which I've given, and which the health department has shared with us, which basically just lays out some of the fundamental things about COVID-19 which we need to keep in mind. Many of us, I think, are suffering from an information fatigue. Every single day there's something new. Every single day there's there's a new bit of information about the vaccine, about how the disease spreads, whether it's airborne or whether it spreads through droplets, what kind of mask to wear. So it is very easy to get tired and to just switch off. And therein lies the danger. When we do this, we drop our guard. When we do this, we are not up to date. Please remember that the virus is working faster than all of us. It truly is. We have seen this when we were deliberating on ways and means to go about our strategy, and then we see something happening. The rate of deaths has suddenly increased, or the spread has suddenly gone up to, has multiplied threefold, tenfold, and hence we have to be on top of things. So we are working with a virus which is unseen, but which is so very smart and which is working faster than all of us. Even as we speak, we don't know about the many other mutations that it can take, and hence it is important, even as you may be suffering from an information fatigue, to remember to keep yourselves apprised and to know what is the correct source of information. For this, we have so much information from genuine and authentic sources online, for your local newspaper, from the National Health Mission Facebook page, and the Meghalaya COVID Task Force, as well as the Office of Deputy Commissioner. We have our social media pages in which key pointers and key information which needs to be shared with the public are done. At the same time, this IEC is being done through efforts on the ground. And so it is important to remind yourselves about what is COVID, what we are dealing with, and how we need to prepare ourselves against it. So this is just a very short summary of all these things. So first of all, we have said time and again that the spread of COVID is so much more than what we presently know. There has been a study by the Medical Expert Committee which showed that the numbers of people who are actually positive or who have contracted the disease maybe up to 25 times more, because not everyone is coming for testing, and hence for every one person who has tested there may be at least 20 more infections, and hence the need to always test, to always treat yourself as an asymptomatic carrier. This we have talked about time and again. Only if we treat ourselves as asymptomatic carriers and follow the requisite protocols can we effectively contain this virus. So these are just the basics. This is the three-pronged strategy in point 2, which I want all of you to remember. When we educate ourselves about containment. That is, we have to, containment doesn't mean strict containment measures, that we have to write containment zone and put it on a banner. Wearing a mask itself is containment, right? Wearing a mask, cleaning, washing your hands, ensuring that you do not venture out of the house if you have symptoms. These are all containment measures. They are steps to prevent and contain the spread of the virus, right? Isolating yourselves from other members of the family. This is what containment is. Vaccination, I will deliberate at length on that later. And lastly, treatment. This is something which we've ignored in the past, or which we have left to the medical experts, the medical specialists. It is important to know the basics of COVID treatment, and especially to watch out for the symptoms which you have in yourselves if you are to effectively, prevent deterioration and even death. So we know that it's a virus and these are the symptoms. And increasingly this year, we have seen that not everyone may have fever or sore throat or dry cough. In fact, some people only have diarrhea, some people have body aches. And the one important point which I want to share with all of you, and I want all of you to take note of, is that every single day in Shillong City and in East Khasi Hills District, we are still coming across people who deny that they have COVID because they say that these symptoms are symptoms of a common cold, that we have this every year, that it is seasonal. In Khasi, we say it's kabayong kle, man kapor shaitlong kumne. So there is nothing to worry about. And let me tell you, this is not just, people in the village just saying that. It's educated people living in Shillong City who may be in a state of denial because they possibly don't want to come forward to test, or perhaps because they do not believe that they have COVID. Let me tell you that if you have any of these symptoms, it is required that you consider that you could possibly have test positive for coronavirus, and so come forward and get yourself tested. It is no great shakes. There is no problem with regards to testing. It may be a little itchy and it may hurt a little bit, but by doing so, you will know your status, you will know the status of the people around you, and you will be able to protect yourselves, your families, and your loved ones better. More than 90% of cases can be easily managed at home, which is to say that many people are asymptomatic. Yes, 30 to 40% have symptoms, but not everyone needs to be hospitalized. But the scary thing about this variant of the disease is that a few do become very serious. And this is what our health experts have said, that the body reacts, your natural immune system takes over, and it produces, the body, the lungs produce a cytokine storm to fight the infection. And there are various mechanisms that take place, which, if not corrected or if not treated early, can lead to further deterioration, which can lead to lung damage, organ failure, and even death. And this is where my second point comes into play. And this is something I want to share with all of you. Almost 17% of our deaths in East Khasi Hills District are cases which die at home or which come to the hospital in a broad dead state. which means that people are still waiting to the very last, are still waiting till their symptoms become very serious before they come forward. We don't know the reason for this, but like I said, it could possibly be denial. It could possibly be that they're too scared to come forward. They don't want to be tested positive, or it could be that they do not have enough knowledge, right? What I want to stress and what I've been saying, through all our press conferences and through all our meetings with community leaders, is that do not ignore your symptoms. If you have symptoms, please call the local helpline, tell your medical officer, call 14410. It will help us help you better, because we can monitor whether your symptoms are getting serious. You can be tested on time, and our doctors in the various hospitals in Shillong city tell us that if people come forward on time, there is a better chance of improvement and there is a better chance of survival, right? Older people, comorbid people have a higher risk to succumb to this disease. And this is where it is important for younger people, for students, for mobile people, people who go out to work, to be very careful in their goings and comings. If you wear a mask, you can ensure that when you come back, you do not pass on the virus to your elderly parents or grandparents or relatives. So these are the ways in which it spreads, right? And you know that crowded spaces, close contact settings, unventilated or closed spaces are very, very dangerous. In fact, all our awareness programs now, we are trying to hold outdoors or in places which are very well ventilated. We had to close down gatherings of all sorts, and this is all for a reason. So please remember, don't be under the mistaken assumption that crowded places means only, my church or my school or my college. We have seen that in many localities, people have misconstrued the meaning of lockdown, whereby they think that it's still okay to visit your neighbors or your close friends. And this is where the family spread, the community spread happens. Please remember that if we can isolate the virus for a period of 10 to 14 days, which is an entire incubation period, only then can we kill it, right? The virus can be stopped by the movement of people. The virus can be stopped by containing it. And hence it is crucial that we do not give a chance for such unruly, crowded, highly dangerous settings to become super spreaders, right? Containment, vaccination, and treatment, right? So on vaccination, I will go to a separate slide, but on treatment, we have a home care protocol. And this is what I want all of you to educate yourselves on. We have even trained community volunteers. Our ashas, our incident commanders are training community volunteers just to know, just to tell people about what are the basic signs you should watch out for and know when you are to seek help. Like I said, let us not wait until 4 or 5 days of having serious symptoms. It is important to watch your symptoms very carefully. We had a reputed medical practitioner, Dr. Varghese, who had spoken to us through a similar webinar a couple of days ago. He was interacting with some of our medical experts, and he said that it is important to number the days of your symptoms. The day that you get your first symptom, the day that you get the second day that you get symptoms, it is very, very important, because scientists have actually said that those who have the tendency to get worse suffer an increase in the seriousness of symptoms between the 5th to the 8th day. So if your symptoms do not improve despite taking medication after the 5th to the 8th day, please do not hesitate and do not wait any longer, but seek proper medical care. Now, these are all the tried and tested methods, which are very important. Testing is crucial. We still have people who are so scared of testing. Our positivity rate also depends on the amount of testing that we do. I have given an order that everyone is to wear double masks. I think all of you have come across this double mask or N95 mask. Please don't wear masks on your chin. Please don't wear masks on your forehead. This still happens in a lot of marketplaces, which I've seen. There is no point of just having a cloth on your face if it's not going to protect you, right? So basic things like this, which is really proven to save people from infection and to protect lives, right? So we say wear your mask properly, double mask, and we know that the probability of infection through a carrier is very, very low if both the parties are wearing masks. Hand washing always at all times. And I think you know the cardinal principles, you know the proper methods of hand washing, and of course social distancing. Sometimes this goes for a toss, and yes, it is extremely difficult, but practice speaks perfect. I think if all of us imbibe this practice within ourselves, it becomes more easier. The longer time you spend with somebody in a closed setting, the higher the likelihood of you to contract the disease from that person. Ventilation is really crucial in the rooms that you sit, even at home. And it's summer, if we don't have rain, it's beautiful to let the air come in. Cross ventilation is crucial. So please remember to practice this in all the places that you go to, okay? Containment measures. We still have so many people who are confused about, I've tested positive, what do I do? My family members are staying in the same house. Now, this is one of the points which I want to raise, which is that we are encouraging people who don't have space within their households. If you are tested positive, please inform your medical officer, because we will try to arrange an isolation facility for you. We have many isolation and quarantine facilities across the city. In fact, the other day we had visited the Don Bosco Youth Center, in which Father Makri and others have been very kind in giving that center as an isolation center, so that people who are infected and do not have the proper facility at home can come and stay there, so they don't risk infecting other members of their family. Early testing is crucial. Vaccination. So we'll go to vaccination. Now, yesterday, I'm so happy to share with you that we opened up vaccination for the 18 plus group, and we did it through the on-spot registration method. That is, you don't have to book for a slot online anymore. And we did it with a close collaboration of our community leaders, our CCMTs. We had a tremendous response. Almost 5,500 people came forward. Today we have the same response. So it's great to see that people are coming forward. But at the same time, there is a lot of hesitancy in our area. Now, our experts have told us vaccination reduces the risk of getting infected. In fact, when we look at our records, most of the people getting infected are those who have not gotten vaccinated. So we are not saying that if you are vaccinated, you will no longer get the infection, but we say that the risk of getting infected is much less if you are vaccinated. Vaccination prevents death and severe infection. It has been proven to help reduce the chances of hospitalization. And vaccination, most importantly, does not protect only yourself, it protects your family as well. That's why we say that until and unless 60 to 70% of the population is vaccinated, it will become very difficult, because only if a sizable chunk of the community is protected can we have what we call herd immunity. And we want to achieve herd immunity through vaccination alone. We don't want to achieve herd immunity through risking more people getting infected, because this will also mean more people dying. Who can get vaccinated? So anyone in the age group of 18 plus is eligible for vaccination, and vaccination is available in so many health facilities. It is coming to a community center near you. Vaccine stocks are being replenished on a regular basis by the health department. We have sufficient stock as of now, and more stocks are coming. So the aim is that really we reach out to everybody who is eligible, so that we can protect ourselves, right? We had shared one of our reports with the media recently, in which we have shown that out of all the deaths that we've had, none of these deaths were of those of people who have received both doses. So this truly shows that people who are vaccinated are protected against death. And our doctors who we interact with on a regular basis also talk about this. Now, of course, pregnant and lactating women, people below 18, on whom the vaccine has not been tested, are not recommended, but data on this and studies on this are dynamic. So we will always need to keep abreast of the latest instructions. Facilities are available, and if you are 18 plus, I do expect, and I will request Father, in fact, to do a quick survey to find out how many students of the college have been vaccinated. what to expect after vaccination. Many people are scared because they say that I'll suffer some side effects. We've heard about the whole blood clotting scare, but what we have seen, we do not have a single adverse effect related death in our state till now. Vaccines are safe. There are minor side effects which will go away. And in fact, some of these side effects, which I also experienced, a bit of fatigue, a bit of fever, shows that the vaccine is working. All right. And we need both doses. We have Covishield in our state and we need both doses. The second dose can be taken up to from 12 to 16 weeks after the first dose. Now, this is what I want to share with you. We have various vaccination. It's like the first is that, a year ago, how is it possible that scientists have really come forward with a vaccine in such a short amount of time? Please do remember that, technology and medical science has progressed so much. People have been working around the clock, and all safety protocols have been adhered to. Emergency use approvals have been obtained, all the required tests and surveys have been done, and the vaccine has been proven to be effective. Doctors have told us. And people who say that vaccines are not effective, many times I ask them, when you have a headache or a fever or a sore throat or diarrhea or a body ache, or you fall down or you have a minor cut, you go to a doctor because you trust him, right? And he has studied medicine for 5 years, 10 years. You trust your medical officer. But why is it that in this case, suddenly there's this huge resistance and we say that, no, we don't trust our doctors, we don't trust our government? I think this is a very contrary opinion to have. And this is also the line which we are taking when many people say that they don't want to get vaccinated because their faith does not allow them to, because to trust in God is enough. So we always say that if you trust in God, then how is it that if you have any other disease or sickness, you take medication, right? So we are not being consistent in our approach. So vaccines are effective. I think there are no two ways about this. Myth number 2, for girls, many say that don't get vaccinated during your periods because your immunity is low. There is no scientific basis for this. It is completely safe. If you have had COVID-19 once, you no longer need vaccination. That is not true because it is possible to be reinfected. But at the same time, there is a particular wait period that you cannot get vaccinated immediately after you are recovered. You have to wait for some time. After I get a vaccine, I no longer need to wear a mask. I think this is ridiculous. A few countries like Israel have gone for a no mask policy because 90% of their population have been vaccinated. If I am vaccinated, I still need to take precautions because I can still get infected. Like I said, I can still infect others, but the likelihood of me getting seriously infected will be much less. And please remember why we need 2 doses. We become fully immune, or the immunity sets in 2 weeks after the second dose. So let us not be callous and think that after the first shot, one hour after the first shot, I can go and party, I can go and step out without a mask. No, we still have to be tremendously careful. Vaccines can make you infertile and are unsafe for diabetics. So a lot of the scares in our state, a lot of the talk, especially amongst illiterate sections or people who don't really have access to proper information, is this, that vaccines can make you infertile. There is no evidence as such for this. And like our doctors have told us, many women who have planned for pregnancy after taking the vaccine have become pregnant. And this is useful because for many families, who are planning, many mothers who are planning on getting children, we tell them that you can delay your family planning for a bit, get yourself vaccinated first, and there has been seen to be no adverse effect whatsoever. The second thing which I was pointing out is that the vaccine is completely safe and all necessary protocols have been taken care of. So just watch out for these kinds of myths which are oftentimes shared on social media. There are some crazy myths as well, like eating garlic can help prevent infection, gargling is enough. Home remedies are well and good. They can protect you to an extent, they can help you feel better, they have a placebo effect and various things, but these are not scientific. It is completely in fact misleading to say that doing doing pranayam or doing a particular exercise or eating garlic or eating this and that will help prevent me from getting infected, because it is not based on fact and on hard science. Some myths are dangerous, like the myth about wearing a mask, that it will make you fall ill and it will make you sick. And we have time and again said that what will happen if you don't wear a mask is in fact worse, because you become highly susceptible to COVID-19. It can even kill you. Lastly, using fear, using persuasion, using alarm to trick people and to dissuade them. What I've been really surprised at is the fact that studies and short clips and videos which have been shared from around the world in various languages are really infiltrating our our social media pages, and they are being shared like wildfire. And one of these is, like I said, that it can make you infertile, that it's part of a huge scientific experiment, that it's the number of the beast, and so on and so forth. I will ask all of you, as young educated students of the college, to kindly check the source first before you share vague and untraceable sources. Always verify, always know what is the source. And there are a lot of fact checkers online, pages and websites dedicated to demystifying COVID and also to help you fact check. See if other people around are saying the same things. And like I said, these are some good sources within our state, within the country, the WHO page, where you can get good sources of information, and other WhatsApp, Instagram, and Facebook sources may not always be accurate. All right. So for treatment, I think we're running out of time, so I will not go deep into this. But like I said, it is important to educate yourself on what are the things you can do at home in case you opt for home isolation, and how you watch out if you have COVID. All right. So this is a slide. So I think I'll just take another 5 minutes to talk about the role of communities and the role of students. Do I still have time, Professor?
Yes, ma'am. Go ahead.
Please take
Sure.
your time.
Yes, ma'am.
2-3 minutes. So basically, Brother Albert also, said that what can we do during such a time? Now, like I said, first of all, we have given a call out in all our communities, in all our, Shillong and villages, for community volunteers to come forward. People who are hale and hearty, who are, able-bodied, who are strong, and who are vaccinated. If you want to assist your local community in awareness, in door-to-door surveillance, in distribution of essential commodities and rations, and various other things which are required during time of pandemic, please get in touch with your respective war room. Okay, we know that, I think you've seen the information we've given out, that each zone and each block in Shillong has a dedicated helpline number. We want community volunteers, and you can help even from the comfort of your own home. We have even given a call out for community volunteers for dead body management. As you know, initially only the Shillong Municipal Board was handling deaths, and people are still very scared to handle dead bodies, even though we have insisted and we have given awareness that if a dead body is properly prepared and the orifices are sealed, it is kept in a body bag, it is least likely to spread infection. But since there is a lot of fear and of course naturally a lot of trauma for affected families, we have had dedicated teams. So in the past couple of weeks, I've been very happy to note that community volunteers, young boys, have come forward and they have been trained by our teams as community volunteers. We also had people who rendered transport services. During times of lockdown, not everyone has a private car, public transport is shut. So we have asked our BDO NGOs, if anyone has access to a car which is just lying at home, and if you want to help out and the driver is willing and is trained, we can use it as a community ambulance to help ferry people who need to get tested or who need to be hospitalized or other such things. At the same time, we have given a call out, to people who who can assist in various ways in the war rooms, in the health facilities, and now especially for vaccination, for disseminating information on vaccination and in your respective localities, for helping in queue management, for helping in facilitating turnout on days of vaccination. These are all the various ways. But like I said, most importantly, I feel is our role as educated youth in dismantling all the various myths and notions that people still seem to stick on to. And I have recently, our office, through the District Task Force for Vaccination, we launched this I Pledge 10 campaign. I don't know if any of you have seen that, but what we said was that if you are 18 plus and above and you have gotten vaccinated, please help to spread the message to at least 10 more of your elderly family members and friends who still are not coming forward for vaccination. It is a fact that people above the age of 45 in our state are still very hesitant. In the whole of East Khasi Hills district, only 40% of people above the age of 45 are vaccinated, even though the vaccine has been made available to them since the 1st of April and vaccine stocks have been available, right? People are not coming forward, and it could be one of many reasons. So what we launched this campaign because we see that young people are energetic, they are youthful, they are very smart, they are quicker to find ways and means of clarifying their doubts. And they also don't want to stay at home for too long. So they understand that if they get vaccinated, they can be protected. The faster all of us are vaccinated, the sooner we can get back to normalcy, whatever normalcy means, right? So our campaign was meant to encourage others to come forward, and especially members of our household who are elderly, who are at more risk, and who still have doubts to clarify. I think at an individual level, many of you can do so much just by talking to your friends, talking to your kong, your housemate who comes to the house, talking even to your grandfather, your acquaintance, your local shopkeeper, and asking him whether he's gotten vaccinated. If not, why not? Any doubts and fears, share with him the pamphlets which we give, many of the online creatives and IEC materials which we share. This is a race against time. We set ourselves such huge targets, and we are so discouraged some days when we see that 15 vaccination centers in East Khasi Hills had zero turnout, and this has happened, right? So yesterday and today gives me great hope because we have achieved almost 5,000 per day, and this is mainly because of the turnout of young people between the age of 18 to 44. So I feel that all of you young guys can really play such an instrumental role in this. And we don't have enough time, but if there's any other doubt or query that you have, please feel free to reach out to us on our social media pages. Our official email is there on which you can clarify, and we will also share some of the the forums through which all of you can engage and volunteer from time to time. So I think I've taken enough time already. Sorry for overshooting the time, but thank you so much for giving me an opportunity, and I'll hand it over back to you, Professor.
Thank you so much, ma'am, for that information that you have given us and provided us, I'm sure, many of the doubts that our students would be having, or any of our teachers who are also watching. Many of our staff are also watching this program. I'm sure their doubts would have been cleared. This is just for your information, ma'am, and also a reminder for many of our students that we do dedicate one class per year to talk about social responsibility to our students in every year. And so maybe this time our social responsibility stands to following the basic strategies, especially help in not spreading rumors and check your source of information, not to stigmatize, reach out in your own creative and possible ways, taking the tests when required, and also talk about vaccination, go for vaccination. Maybe we can do the bit that we can in our very own way. because when we talk about social responsibility, we've always talked about reaching out to others, but maybe if it is not possible for all to do now, but your own bit, do your part, I'm sure it will help in a lot of ways. Ma'am, just to inform you also, last week we had a talk by Dr. Shomi Raman where he had clarified many of the doubts regarding vaccination. And I'm sure many of our students were very happy with it. And I'm sure with this on-the-spot registration, it has helped many of our young people to also get vaccinated as well. This program for today, ma'am, has also been viewed by more than 500 plus members in Zoom, as well as it is going live in YouTube. So I'm sure you've been able to reach many number of students and young people through this program as well. But respecting your time, we will not take any more questions because there's a time limit. I'm sure you are busy with many other things as well. But we would like to thank you for sparing your valuable time, especially in a time like this where you need to decide on the spot for so many things, but yet you still spend a lot of time with us, almost more than an hour, speaking to our students. We are very grateful for that, ma'am. Thank you so much. And Father, if you would like to say anything, brother.
Thank you, ma'am, so much. It was so eye-opening. I'm sure we are with you as a college, and in whichever way, I think I will keep tagging you again. Thank you. God bless. Brother Albert.
Ma'am Isawanda Lalu, thank you so very much to you. You have done an excellent job in clarifying many doubts. Our students are hearing and seeing. They are in YouTube. Not only our students, our alumni, then the family of our students are hearing. Thank you so very much for your time. And I repeat what Father Joby says, we are with you. Please do not hesitate to ask any assistance and help from our college. Thank you, ma'am.
Thank you so much, Father, Brother, Professor. It's been a wonderful time with all of you, and I really appreciate you having organized this and reaching out to the student community, and also for your tremendous support from time to time in various ways. So I look forward to Father tagging me in his future posts, and I can also see that many students have questions. So if you could please compile these questions and send it across to us, I can get my team to answer these questions, particularly on vaccination and slot booking and other such things. So thank you.
Ma'am, there's one question I think maybe you can address now itself also. Where can we find centers that we can get vaccinated on the spot without prior booking of a slot?
So I'd just like to inform you that apart from the online booking, which is already done from the 11th to 19th, for 11,820 doses, we also have spot registration, which has started through the health facilities. Okay, and we have around 63 health facilities, urban health centers, PHCs, CHCs in our city. And these centers will be conducting, starting yesterday, in fact, they are conducting vaccination sessions for the community at the community level. So as and when a session will be held in your locality, say today we had one in Jaya, one in Maukhar, one in Maupat, as and when it comes, public announcements will be made in your locality. Medical officer will reach out to the Rangba Shnong, to the Welfare Society, as well as to the CCMT, and the communities have devised a mechanism to ensure that all people have access to the vaccine. Another point I would like to raise is that these community session sites will be ongoing. Many more stocks are coming forward, and at the same time, what we have said is we want to prioritize also for breadwinners of the family, single parents, people who are mobile, people who are vulnerable. Many families have been left without a primary breadwinner because the father or the mother of the household have passed away. So we have asked communities to help us identify these vulnerable persons to prioritize, but also that all willing people will get a chance. And we have had tremendous response in all the community session sites which we've started in the past 2 days. So don't worry, as and when the site comes to you, we will publicize it through our pages and through your local medical officer as well as your local community authorities. I hope that makes it clear.
Thank you, ma'am. I'm sure students have understood that. And so with this, we will take a leave for today. This is just for the students. Link will be shared, a single link will be shared for your attendance as well as feedback and for certificate as well. Correct, no, Father?
Correct. It's a single link for.
So you can fill that within 30 minutes.
It will auto inactivate after 30 minutes.
Okay.
Thank you, ma'am.
Okay, so thank you once again to all the panelists and the students as well who have been watching us. We hope you stay home and stay safe. Thank you so much.
Thank you.
Thank you. Thank you, ma'am.